All right, welcome back. Hope you're having a great week. Today we're continuing our review of our latest BCBA practice exam, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out behavioranalyststudy.com. We offer our 3 current practice exams, the task list study guide, and of course our combo pack. When this study guide is done, we will send that out to whoever currently owns the 3 practice exams or the combo pack. This is our 4th practice exam. As usual, questions, comments, please let us know. Work hard, study hard. Let's get to our questions. 81. A high school cheerleader is attempting to learn a routine for the upcoming team tryouts. She needs to be able to do the entire thing flawlessly. Her coach, a BCBA, develops a self-management program for her to use, but she is still only able to learn 80% of the routine. What dimension of ABA does the intervention lack? One thing we need to remember about ABA is it's not just an autism science, and we really get caught up in that world because it is mainly used for autism. But what we have to remember is that it can be used in any really domain. So don't be surprised by questions that have nothing to do with disabilities or autism, right? They're trying to test your overall knowledge and application of our principles and our fundamentals. So in this case, we are asking about the dimensions of ABA. Now, when we talk about the attitudes of science and the dimensions of ABA, these are, in theory, very easy questions, but they can get very tricky and very complicated very fast. So you really want to take your time on these questions. They're easy points, but if you rush through them, they're very easy to miss. So in this case, we have a high school cheerleader who is attempting to learn a routine for team tryouts. She needs to be able to do the entire thing flawlessly. So that is really the goal, right? Her coach, who is a BCBA, develops a self-management program for her to use, but she is still only able to learn 80% of the routine. Has she accomplished her goal? She has not. Maybe the self-management program has helped, but she still hasn't quite reached the goal. And without reaching the goal, she's not going to make the team. So what dimension of ABA does it lack? A, behavioral. Behavioral just says we are observing and measuring behaviors, public events, things we can change. And sure, right, we can teach the new tryout or we can teach a new routine. The coach can change the intervention to change the behavior. It is a behavioral intervention. B, conceptually systematic. Well, the coach is a BCBA. She's using a self-management program and she's tracking it. It seems very conceptually systematic based on the information we've been given. C, effective. Effective says the intervention needs to be significant in its change and it needs to be socially valid and meaningful. Yes, maybe she has improved on the routine, but the fact that she still won't make the team does not really make this effective. Learning 80% of the routine is not enough to meet her socially valid goal. It doesn't really make this intervention very effective. And then D, technological, says whatever treatment was written or whatever intervention was written could be repeated. We're not sure either way. We don't have the information that says it is or isn't technological, so we can't definitively say it lacks that aspect, so we can't pick that answer. It is behavioral. It is conceptually systematic as far as we know. It just isn't effective. Effective, it needs to make significant change that's meaningful and socially valid. Learning 80% of the routine is not going to be socially valid as far as this high school cheerleader is concerned. 82. Jermaine has been fully potty trained for 3 years now. He has been making significant strides in his therapy, and his self-help skills and independent living skills are approaching typical levels. One night, Jeremy wets his bed. He then wets his bed 4 more nights in a row. As a BCBA, what should you do first? Now, this is testing a very specific ethical rule that our code has. Anytime we see some significant change in behavior that has to do maybe with a biological cause or an internal cause, or even maybe an outward cause that really has no explanation behaviorally that is immediately apparent. And in this case, when Jermaine's been potty trained for 3 years, he's been making strides, and then all of a sudden, he wets his bed 5 times. It doesn't make a whole lot of sense. So, ethically, as a BCBA, what do we need to do? A, interview Jeremy's parents and determine what might have changed in his routine. Sure, this would be a logical step in a functional behavioral assessment. But even before we start our FBA with an indirect assessment and we go through the procedure of writing a plan, what do we need to do first? B, re-implement the same potty training procedure from 3 years ago. Do we plagiarize interventions? Do we just reuse interventions? No, each time we make an intervention or create an intervention, it needs to be based on a new behavior assessment. C, suggest that Jeremy's parents consult a medical professional. Yes, and this is what they're looking for, right? You need, and we need to, as BCBAs, in situations like this, rule out all possible medical scenarios first. Because wetting the bed 5 times, really out of the blue, could be an indication of a much more serious issue, right? So in this case, before we go into our indirect and direct assessments, we have to rule out this is a medical issue. I had a very similar thing happen to me as a BCBA, and it did end up being more of a medical issue than anything else. So we need to rule that out first before we start developing behavioral procedures and interventions. And then D, punishment procedure for bedwetting. You're not going to immediately jump to a punishment procedure for bedwetting. We definitely do not need to be picking this answer. It's definitely the worst answer, right? So the first thing we need to do is suggest that Jeremy's parents consult a medical professional. 83, before he takes an exam, Blake always takes 3 sips of water and eats a Kit Kat bar because he once aced an accounting exam using the same strategy. What most likely explain Blake's behavior? What's another word for Blake's behavior? Before he takes this exam, he has this routine, right? He's going to take 3 sips of water. He's going to eat a Kit Kat bar because one time he aced an accounting exam. Does the 3 sips of water and eating a Kit Kat bar really have any impact on the accounting exam? Probably not. This is really superstitious behavior. The superstitious routine of always doing the same thing because in the past, for some reason, good things have happened. So Blake is now superstitious when it comes to taking this accounting exam. In this case, how do we explain Blake's behavior? Remember, from a behavioral standpoint. A, there's a functional relationship between Blake's routine and acing his exams. Do we really believe that there is a functional relationship between 3 sips of water, eating a Kit Kat bar, and acing the exam? Probably not. Either way, we have no way to prove a functional relationship because there is no experimentation happening. So we cannot pick A. B, there is a contiguous relationship, between Blake's routine and acing his exams. So this word, contiguous, otherwise known as contiguity. And when we talk about contiguity, what are we talking about? Well, we're talking about closeness of a consequence to a behavior. Superstitious behavior is formed because a behavior occurs and then something very close to it happens. So last time Blake took his accounting exam, right? He took 3 sips of water, ate a Kit Kat bar, and then crushed his accounting exam. So the contiguity between the behavior and the result of acing the accounting exam is what formed the superstitious behavior. C, there's a respondent relationship between Blake's routine and acing his exams. Well, Blake's routine is maintained by consequences. Remember, respondent relationships are not maintained by consequences. And then D, there's no explanation for Blake's routine. There is an explanation. There's a contiguous relationship, a closeness between Blake's 3 sips of water, eating a Kit Kat bar, and this result of the accounting exam. That contiguity has formed the superstitious routine for Blake. So our answer here is B. There's a contiguous relationship between Blake's routine and acing his exams. 84. Which of the following scenarios portrays errorless learning? What is errorless learning? Well, errorless learning is preventing our clients or learners from making mistakes because mistakes lead to more mistakes, especially when we're teaching new skills. Mistakes and errors can quickly become part of those behavioral chains, and we don't want that to happen. So we use errorless learning and errorless teaching to prevent errors from happening. And that is in the most literal sense, right? With errorless learning, we are preventing errors from happening. So we're looking for the scenario where that's occurring. No errors can take place. A, Davey is learning to use a zipper. His mom lets him grab the zipper and attempt to pull and then helps. If his mom is waiting for him to make an attempt, Can an error occur? Absolutely. So this cannot be errorless. B, Marshall is told to pick out a red shirt from his closet. He asks where the closet is, and you say in your bedroom. By telling him where the closet is, does that prevent errors from Marshall picking out a different shirt? No. He might find the closet and then pick out a blue shirt. C, a BCBA is using forward chaining to help his client wash their hands. The BCBA reinforces only when the learner turns the water off. Is there a chance at an error here? Sure, this is forward chaining, so the client needs to go through this entire chain before getting reinforcement, meaning there are many steps where errors can occur. That leaves us with D. A mom helps her son tie his shoes by holding his hands the entire time through the chain. This is a full physical hand over hand prompt. This is the most definite way of errorless learning. By full hand over hand prompting, the mom can prevent errors from occurring because she is essentially doing what? She's essentially tying the shoes for him. And by tying the shoes for him with hand over hand prompts, she is engaging in a type of learning that is errorless. So which of the following scenarios portrays errorless learning? Well, a mom using hand over hand physical prompting to prompt her son through an entire chain of shoe tying. 85. A 4-year-old watches his dad cook and says carrots. The dad says dad is using carrots to make a stir fry. Each time the dad is cooking with carrots, the 4-year-old says carrots. The 4-year-old is most likely using what verbal operant? So we have two people in this question. One part of the battle with behavioral questions is identifying who you're looking at and what behavior you're looking at. In this case, are we concerned with the 4-year-old or the dad? We're looking at the 4-year-old. And the 4-year-old, what verbal operant are they using? So we know they watch their dad cook and says carrots. So right now, immediately, you're thinking probably either tact or amand, right? A tact, they're labeling the carrots. Amand, they're asking for the carrots. And what's going to help determine whether it's a tact or amand? Well, in this case, we need to see what the reinforcer is. Because if it's a tact, it's probably going to be some sort of generalized conditioned reinforcer, praise, attention, something like that. If it's amand, the 4-year-old will get the carrot. Well, in response, the dad just says dad is using carrots to make a stir fry. The carrot is not given. Now, each time the dad is cooking with carrots, the 4-year-old continues to say carrots. So we can pretty definitively say this is more of a tact than amand, because amand is reinforced through the thing or the item that was requested. A tact is just reinforced with a generalized conditioned reinforcer, in this case, some sort of verbal attention. So is the 4-year-old is most likely using amand? No. A tact? Yes. It isn't an echoic. The 4-year-old is not echoing the dad. And it is not interverbal. We're not looking at the dad's behavior. We're looking at the 4-year-old's behavior. The 4-year-old is most likely tacting the carrot. So they're most likely using a tact. 86. What separates a functional relationship from a causal relationship? Now, this is more of a high-level question. We might not see something this on the nose. You might, right? But it is very on the nose. It is very much a fluency check. But that's okay. Okay, we need those every now and then to keep us sharp. So we're looking for the difference between a functional relationship and a causal relationship. So first, what is a functional relationship? Functional relationship says our independent variable, our intervention, our change caused a dependent variable or behavior to change. Okay, we're not saying it's the only thing that can change behavior. We're just saying in that moment, that's what caused the behavior. A causal relationship is saying this is what changes the behavior. Okay, this is the reason this phenomenon or this event happens. If it's causal, and we're saying there's nothing else that is causing this thing to happen. A functional relationship is much more loose, right? There can be many different interventions leading to the same outcome. That's a functional relationship. If we have a single intervention, and that's the only intervention that can lead to an outcome, that's causal. So what separates the two? A functional relationship and a causal relationship are the same thing. They are not. Don't make that mistake. B, a functional relationship is stronger than a causal relationship. It is not. A causal relationship is stronger than a functional relationship. C, a causal relationship exists if no other variable could have led to a change in behavior. Yes, that is what we're looking for. If no other variable could have led to the change in behavior, no other variable at all, it's just a single one, we have a causal relationship. Okay. A functional relationship exists if no other variable could have led to a change in behavior. No, that's going to be a causal relationship. Our functional relationship is just looking at that variable we're controlling, right? There could be many more interventions, the same effect. So a causal relationship exists if no other variable could have led to a change in behavior. 87, you're a BCBA working at a residential home for adults. You're fully qualified for the job. One day, a client asks you to help them quit smokeless tobacco. You conduct an FBA and write up a self-management plan for the client. A behavior contract is also signed with stipulations around using smokeless tobacco. After 2 weeks of success, your client says they changed their mind. What should you do? And this is a very interesting question. There's a lot going on. We should never, ever jump right to the answer choices. You need to fully understand the question before you even think about picking an answer. We're asking about what we should do. So let's break it down. So you're a BCBA, home for adults. That matters, right? You're fully qualified. Your client wants them to help them quit smokeless tobacco. So they asked you to design a plan. You do an FBA, write up a self-management plan. Great. You also sign a behavior contract, which is interesting, around smokeless tobacco. However, after 2 weeks of success, your client says they changed their mind. What should you do? Now, remember, a residential home for adults. No, the clients have a right to what? Well, the client can say at any moment, I don't need your services. I don't want this. Okay. We have to keep that in mind. If it's a residential home for adults and they have power to say, I don't want this. Okay. So in this case, we have a contract in place. We have a self-management plan in place. What are we going to do as the BCBA? A, continue to follow through on the intervention, implement any consequences laid out in the contract. This would be unethical. We have to respect the client's wishes. You have to treat them with dignity, right? B, to terminate your relationship with the client due to failure to adhere to program guidelines. Client hasn't done anything wrong. They have the right to terminate this procedure. C, encourage your client by showing them their progress, but respect their wishes to discontinue the intervention. Sure, you can encourage them. Look at all this progress you've made, blah, blah, blah. But if they just say, I don't want to do it anymore, you've got to respect that. It's not illegal what they're doing. They're not hurting anybody else. It's their life. They're of age. They can make that choice. D, offer your client an even bigger reward for completing the intervention. You should not do that. That is very, very close to a bribe. This is what the client wants. They are fully in their rights to prevent this or end this intervention, and you have to respect that. So what are you going to do? You're going to encourage your client by showing them progress, but respect their wishes to discontinue the intervention. And this can be very difficult for us because we believe we know what's best, right? But you have to remember, they're adults. They have the same rights we do. You wouldn't want somebody, if you hire a therapist and you don't like what they're telling you, you can fire them. Same thing applies here. You don't have the right over them to control their life. 88, the Chicago Symphony's piano player gets sick before a big performance. The backup piano player is asked to fill in, but is struggling keeping up with the tempo. The backup cannot play the notes quick enough. What should you try to decrease? So the key word here is decrease, all right? Because if you read it, okay, we have this backup piano player who can't keep up with the tempo. Basically, they play too slow, right? They can't play the notes quick enough. Immediately we're thinking, well, let's just increase the speed. Sure, question is asking about decreasing something. You have to be careful. You have to read it carefully and answer what the question is asking. If we look at A, rate, we could increase the rate and be effective. But we're not talking about increase. We're talking about decrease. So if we look at B, into response time, it's time in between responses. If we can decrease the time in between responses, in other words, decrease the time in between notes, well, we might be onto something. Decreasing into response time seems like a pretty good idea. What about C, latency? Is the problem starting? It's not, right? There's no problem between the SD and the first response. And then frequency, is the problem The number of notes. Well, not necessarily. The problem is how quickly they play those notes. So we can increase rate of notes, or we can decrease into response time in between notes. 89. When might it be most appropriate to use a DRH procedure with a client? Easy question. You got to know what a DRH procedure is, but it's an easy question. Differential reinforcement, higher rates of behavior. Remember, DRH, we're not teaching a behavior, we're trying to increase something. So A, your client rarely drinks water and often forgets to drink water over the course of an entire day. Do they know how to drink water? Yes. Do we need to increase their water intake? Also, yes. DRH seems very applicable to A. B, your client engages in severe aggression when denied access to a tangible. Do we want to increase aggression? We do not. Remember, DRH is not teaching a replacement behavior. You're increasing an already known, existing target behavior. C, your client eats an unhealthy amount of carrots. Well, we don't want them to eat more carrots, so no. D, your client has generalized mom to all women in public. We don't want that to continue to increase. Clearly, the answer is going to be A. Client rarely drinks water and often forgets to drink water over the course of an entire day. Finally, consider the following verbal operants. Which operant would you be least likely to reinforce with a generalized conditioned reinforcer? Remember, generalized conditioned reinforcer, things like attention, praise, money, tokens, things that are used to reinforce a variety of behavior. With verbal operants, though, it's important for some of them to be reinforced in a very specific way. So of the verbal operants, what are we least likely to reinforce with the GCR? A, tact. Is a tact reinforced with the GCR? Absolutely, right? Tacts are reinforced by generalized conditioned reinforcers. What about B, mans? Are mans reinforced by generalized conditioned reinforcers? They're not. Mans are reinforced by whatever the request was made for. What about a coex? Coex are reinforced by GCRs. All three should be reinforced using a GCR? No. Mans are reinforced by whatever was requested for. So, which operant would you be least likely to reinforce with the generalized conditioned reinforcer? It's going to be B, mand. Great. Check out behavioranalyststudy.com for BCBA study materials. Please like and subscribe. Questions, comments, let us know. Work hard, study hard. See you soon.